new question comes from a viewer who says they have noticed that strep throat is actually going around a lot of the schools and wants to know how to spot strep throat and treat it. Here with the answers is Nancy Raborn of University Hospital. So we're hoping we don't all have strep throat. We just think we have a little sore throat.
Hopefully not.
Hopefully none of us have strep throat. But what is strep throat exactly? I remember the last time I had it, it was no fun.
No fun at all. Strep throat is an infection of the throat that's caused by group A streptococcal bacteria. And it is spread by direct contact with an infected person or by indirect contact by breathing in the germs, the airborne germs, or by touching an object that has the germs on it.
Now, which is absolutely disgusting when you think you can inhale the germs.
Right.
So you really don't want to be around people that have it.
Exactly.
When they do have it. Okay. So how do you know for sure if your child or if you have strep throat? I remember I did see some white dots.
Right, right. That's a good indicator. And it's a good question because not all sore throats are bacterial infections. In fact, only about 5 to 10% of sore throats are caused by bacteria.
Which is kind of a relief.
Right, exactly. So, and the rest are caused by viruses or other problems that are not treated with antibiotics. So, to determine if you have strep throat, your doctor may perform a rapid strep test by using a long cotton swab and testing the material in the back of your throat, which you may have had that done. And the test, you get the results in about 15 minutes. It's called a rapid strep test. And the doctor may also culture the material and send it to the lab. And the throat culture generally comes in 24 hours.
Now, is that kind of just to double check to see would they do both?
Yeah, well, they may. It's more specific. The second one's more specific and more quantitative.
Okay, I gotcha. Now, what are the symptoms of strep throat? I know some people feel a lot worse than others when they get strep. People kind of react differently.
They do. Most people present with a rapid onset of swollen throat with bright red tonsils. They have severe pain when they swallow. The glands in the neck get tender and swollen. They may have headache or fever. And kids may present with nausea or vomiting. Okay.
Now, as far as ways to prevent strep, obviously, I mean, if it's airborne as well, you just want to avoid contact with people who have it.
Right. Unfortunately, because it is airborne, it's not always preventable, but you can significantly decrease your risk with frequent hand washing and definitely avoid close contact with those that you know that have it.
Okay. And since it is a bacteria, this would be a time when you want antibiotics.
Exactly.
A lot of times people want antibiotics and they do you no good unless it's a bacterial infection. So how else can we treat strep?
Well, the doctor will prescribe an antibiotic, the appropriate antibiotic, so it's important that you take it as directed until it's all gone. And even if the symptoms get better. People make the mistake of, well, I'm feeling better, I don't need any more of this antibiotic now, and then you develop the antibiotic-resistant strains, and there are complications, the infection recurs, so it's always best to take it as long as you're not having a problem with it.
Okay, perfect. And then when you eat, you just want cool drinks, maybe warm liquids?
Right, a soft diet. Frozen popsicles are very soothing to the throat. A nice warm salt water gargle, you can make that by mixing 1/4 teaspoonful salt in 1 cup warm water for, adults and older children. And adults and older children can have throat lozenges, hard candy, pieces of ice to soothe the throat.
Perfect. Yeah, those are the only kinds of things you want when you have a really bad sore throat.
Right, they're so soothing.
Well, thank you so much for being here. I hope that answered the viewer's question. I'm sure it did. That was all the information we could possibly need about strep throat this morning, so I appreciate it.
Thank you. And if they have any other questions, of course, they can call Ask a Nurse at 706-737-8423.
Perfect. And we have that on our website, nbcaugusta.com. Thank you. We'll see you next week.
Thank you.
All right.